The American Heart Association's Sacramento Heart Stroke Walk is coming up on September 25th. This event gets people to get out and get active for a great cause fighting the #1 killer of Americans, cardiovascular disease. It also honors local survivors who've benefited from research funded by the American Heart Association. And now we are going to welcome our first guest. We've got Jimmy Fremgen. Did I say your last name correctly?
So close, Fremgen.
Fremgen. All right, Jimmy. Well, you're here to share your story because you have a heart condition.
That's right. So I have had a heart condition since I was born, but when I was about 14, I started experiencing much more severe symptoms and actually had to go in to have an implantable defibrillator put in. And I dug it out for you guys. So this is my very first pacemaker that I keep around the house. And this is a photo of me getting my most recent one last August. So it is a genetic disease. There's a photo of my mom there, and my mom had the disease before me. My grandfather had it. My great-grandmother had it. It's kind of a family heirloom, unfortunately, in our family.
All right, so it's a genetic condition. You've dealt with it since, like you said, since you were born. So what are some of the ways that you've had to keep your heart healthy?
So heart disease is something that you can work against, and a lot of that is by eating healthy. That's kind of a struggle coming out of the pandemic. It was kind of hard to make healthy choices when you're sitting at home all the time. But for me, since I can't do impact sports, I took up golf at an early age, walking the courses with my dad, and I even took up BMX biking because that was something I could do to keep my cardio up. And even now, I'm 33, and I still go hit the dirt jumps every once in a while. So anything you can to make it fun and kind of find your own way to be engaged and invested in your own health.
That's great, and I think it's wonderful that you found ways to still stay athletic and active. Obviously, heart disease, something that's affected your entire family. So talk about the upcoming Sacramento Heart Stroke Walk. What does it mean to you?
So one of the big reasons that I stay involved with the American Heart Association is because I do miss my mom so much. My mom passed away when I was 19 from the same disease that I have. And heart disease is the #1 killer of women in this country. And so it's really important for me to be engaged and be involved, tell my mom's story, share my story, and help spread awareness about things like the Heart Walk on the 25th, because we can do so much more to make sure that people aren't losing their moms at an early age like my siblings and I did, and aren't losing their grandparents, and get to have that growing up experience with the people that they really treasure in their life.
And why do you feel like it's important for people of all ages to pay attention and get involved, maybe even attend this event?
So definitely what I just touched on, but I think that one of the big things that we really need to be aware of is making sure that we have equity in our healthcare. So, I grew up with a chronic health condition. I grew up in a family that was experiencing it actively. My mom was much more sick than I was. And so at any given moment, I could get a phone call from my dad saying that my mom was in the hospital. And so that led to a lot of mental health trauma for myself and for the people in my family and for the people that loved my mom. And so it's really important for me to be out there and to be proactively working towards making sure that people are taking care of their mental health and their physical health, and participating in things like the Heart Walk help us highlight the physical causes, but also some of the secondary mental causes that we have to go through as somebody that has chronic illness.
And Jimmy, since this is something that has been in your family that you grew up with, what would you say to, younger people, younger children who maybe they're dealing with it and they have a hard time? It changes probably, how they approach going to school and making friends. It can have an effect, but what can you tell them?
Totally. So there are definitely some things that I had to give up when I was 13 that my doctor said were just too dangerous for me to ever do again. And I think that can be really hard to hear at any age, and especially when you're a kid. And so I think the big thing is really experiencing your own illness, owning it, but not letting it rule you. Right? Like, I am not defined by my heart disease or by the fact that every time I go through a metal detector, it beeps because I have this big chunk of metal in my chest. I am me. I get to go through, there it is. I get to go through my life carving my own path. And that's something that's really important, is to really take responsibility for yourself and take responsibility for the positive outcomes that you could have in the lives of the people around you and also for your community. You're not destined to one path just because you have a chronic illness.
Jimmy, very wise words, and thank you so much for sharing your story and also filling us in about Sacramento's Heart and Stroke Walk. You can visit and learn more about the event at sacramentoheartwalk.org.